Good morning, student. Today we have lecture on the dural folds and the dural venous sinuses. Competencies for the today's lecture are: describe and identify the dural folds and the dural venous sinuses. Describe the clinical importance of dural venous sinuses. Objectives of the today's lecture are: what are the cranial meninges? Definition, types and attachments of various dural folds. What are the intracranial dural venous sinuses? Formation and classification of dural venous sinuses. And we are going to see in detail about the cavernous sinus. Cranial cavity and meninges. The interior of the cranial cavity is lined by the dura, and the surface of the brain is covered by the pia mater. So here is the skull bone. The internal surface or the interior of the cranial cavity is covered by the dura mater. Here is the dura mater. And here is the part of the brain which is covered by the pia mater. And between the dura and the pia, there is one arachnoid mater. So three meninges are there from outside in: dura mater, arachnoid mater, and the pia mater. Cerebral or the cranial dura. Cerebral or the cranial dura is strong and it consists of two layers. Outer layer is known as the endosteal layer and the inner layer is known as the meningeal layer. Here you can see, here is the endosteal layer and here is the meningeal layer. Okay. Two layers are fused together except where they enclose the venous sinuses. So the cerebral dura or the cranial dura has two layers, endosteal layer and the meningeal layer. Meningeal layer is continuous with the dura mater of the spinal dura at the foramen magnum. So here is the meningeal dura and here is the foramen magnum, where the meningeal layer will continue with as a spinal dura. At places, this layer is folded on itself to form the dural folds or the septa. These dural folds project into the cranial cavity and they divide it into various compartments which lodges the different parts of the brain. So the meningeal layer is continuous with the dura mater of the spinal dura at the foramen magnum. At places, this layer is folded on itself to form the dural fold or the septa. These dural folds project into the cranial cavity and they will divide the they divide the cranial cavity into compartments which lodges the different parts of the brain. First, we'll see about the interior of the skull. Here is a cut section of the skull and you are viewing the interior of the skull. Interior of the skull is divisible into anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. So interior of the skull is divisible into three fossae: anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. Anterior cranial fossa, in which you are going to see the cribriform plate of the ethmoid bone. Here is the square shaped cribriform plate of the ethmoid bone, which shows the numerous openings for the olfactory nerves. Above that, there is a crista galli, and in front of the crista galli, there is a frontal crest. Here is the frontal crest. And between the crista galli and the frontal crest, there is small opening. This is known as the foramen caecum. Okay. Yes, this is not always present. Sometimes it is present, sometimes it is absent. So in the anterior cranial fossa, three important things are there. Cribriform plate of the ethmoid bone. Above that, there is a crista galli. In front of that, there is a frontal crest, and in between the frontal crest and the crista galli, there is a foramen caecum. Then coming to the middle cranial fossa. In the midline, there is a hypophyseal fossa. On the either side of the apophyseal fossa. Anteriorly, there are anterior clinoid processes. So this is the anterior clinoid process, and posteriorly there is posterior clinoid process. And here is the superior border of the petrous temporal bone, which is present between the middle cranial fossa and the posterior cranial fossa. Coming to the posterior cranial fossa, you are going to see in the center there is a large opening that is known as the foramen magnum. And on the either side of the foramen magnum, you are going to see the superior border of the petrous temporal bone. Then, which will continue with the lips of the transverse sulci on the occipital bone. So, this black arrow shows the lips of the transverse sulci on the occipital bone. So, in this way, interior of the skull is required for the attachment of the dural folds. So anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. In the anterior cranial fossa, there is a cribriform plate of the ethmoid bone, then there is a crista galli, then there is a frontal crest, and in between these two, that means frontal crest and the crista galli, there is a foramen cecum. Then in the midline of the middle cranial fossa, there is a hypophyseal fossa. On either side, there is an anterior clinoid process, anteriorly, and posteriorly posterior clinoid process. Okay. And in the posterior cranial fossa, in the center, there is foramen magnum. Then there is a superior border of the petrous temporal bone, which will in continuation with the lips of the transverse sulci on the occipital bone. Coming to the dural folds. Cranial dura forms 4 folds by reduplication of its meningeal layer. So, cranial dura forms 4 folds by reduplication of its meningeal layer. So, the meningeal layer is reduplicated and it will form the dural folds. These folds are falx cerebri, tentorium cerebelli, falx cerebelli, and the diaphragma celi. So, here is the falx cerebri. Here is a tent-like, that is the tentorium cerebelli. Okay. Dural folds help in stabilizing the brain during the movement of the head. That is the main function of the dural fold. It helps in stabilizing the brain during the movements of head. So here you can nicely appreciate falx cerebri. Then falx cerebelli, this small part. Then this is a tent-like, that is the tentorium cerebelli, and this is the circular diaphragma celi. Here again, you can nicely appreciate falx cerebri, tentorium cerebelli, and the falx cerebelli. And here is the diaphragma celi. So here you can nicely appreciate circular fold of dura, that is the diaphragma celi, and through which the pituitary stalk comes out. Here is the pituitary gland, and here is the pituitary stalk or the infundibulum of the pituitary. Here also again you can see the diaphragma celi and the pituitary stalk. Okay. And here is the tentorium cerebelli. Falx cerebri. It is a sickle-shaped fold of the dura mater. Here you can see. It forms a vertical partition in the longitudinal fissure between the cerebral hemisphere. That means it is present between the fissure of the two cerebral hemisphere. It has two ends, anterior end, which is attached to the frontal crest of the frontal bone, crista galli of the ethmoid bone. So the anterior end of the falx cerebri is attached to the frontal crest and the crista galli. Broad posterior end is attached to the upper surface of the tentorium cerebelli along the midline. So here you can see the anterior end will be attached to the frontal crest and the crista galli. Okay. It has two borders. Superior border is convex and it is attached to the lips of the sagittal sulcus of the skull vault. So here is the attachment of the superior border of the falx cerebri. Inferior concave margin is free. Here is the inferior concave free margin, which lies just above the corpus callosum. So the falx cerebri has two borders, superior convex margin or the inferior concave margin. Sinuses enclosed in this are superior sagittal sinus along the superior border here. Then inferior sagittal sinus along the inferior border of the falx cerebrum. And the straight sinus at the posterior end. Here is the posterior end which is attached to the tentorium cerebelli. So the straight sinus lies in the attached margin or posterior attached margin of the falx cerebri. Tentorium cerebelli, which is tent-shaped and it forms the roof of the posterior cranial fossa. And it forms the partition between the cerebral lobes and the occipital lobes of the cerebrum. It takes weight of the cerebrum of the cerebellum. It has two margins and two surfaces. Margins are attached margin and the free margin. And the free margin encircling an opening that is known as the tentorial notch. So the tentorial cerebelli is tent-shaped and it forms the roof of the posterior cranial fossa. It forms the partition between the cerebral lobes and the occipital lobes of the cerebrum. It takes the weight of the cerebrum of the cerebellum. It has two margins and the two surfaces. Margins are attached margin and the free margin. And the free margin encircle an opening and that opening is known as the tentorial notch. So here you can nicely appreciate the two margins of the tentorium cerebelli. This is the free margin of the tentorium cerebelli. Okay. And here is the attached margin of the tentorium cerebelli. And this is the tentorial notch. So the tentorium cerebelli has free margin and the attached margin. And here is the tentorial notch. Inner free margin is U-shaped and it encloses the tentorial notch, through which passes the midbrain, oculomotor nerves, and the posterior cerebral arteries. Anterior ends of this free margin are attached to the anterior clinoid processes. So these are the anterior clinoid processes and this is the inner free margin which is U-shaped. And here is the tentorial notch. Outer attached margin is convex and it is attached on each side from before backward. Posterior clinoid process, superior margin of the petrous temporal bone and the lips of the transverse sulci on the occipital bone. So this is the attachment of the attached margin of the tentorium cerebelli. Anteriorly, there is a it is attached to the posterior clinoid process, then it is attached to the superior margin of the petrous temporal bone and posteriorly it is attached to the lips of the transverse sulci on the occipital bone. So here you can nicely appreciate the attachment of the attached margin. Posterior clinoid process. Okay, this is the superior border of the petrous temporal bone and the lips of the transverse sulci on the occipital bone. So in this way, this is the attached margin of the tentorium cerebelli. Free and the attached margins cross each other near the apex of the petrous temporal bone. Here is the free margin and here is the attached margin. So they crosses each other at the apex of the petrous temporal bone here. Here is the crossing of these two margins. Venous sinuses enclosed in the tentorium cerebelli. Transverse sinus in the posterior part of the attached margin. Here is the transverse sinus in the posterior part of the attached margin. Superior petrosal sinus is present in the anterolateral part of the attached margin. So here is the superior petrosal sinus, which is present in the anterolateral part of the attached margin. Straight sinus along the line of attachment between the falx cerebri and the tentorium cerebri. So here is the straight sinus. So again, three sinuses are present in the tentorium cerebelli. Transverse sinus, then superior petrosal sinus and the straight sinus, transverse sinus and the superior petrosal sinus. Falx cerebellum. Small sickle-shaped fold of dura in sagittal plane projecting into the posterior cerebellar notch. Here is the falx cerebelli. It is a small sickle-shaped fold of dura in the sagittal plane. It is attached to the inferior surface of the tentorium cerebelli and the internal occipital crest. So it will be attached to the inferior surface of the tentorium cerebelli and the internal occipital crest. It encloses the occipital sinus along with the posterior attached margin. So occipital sinus is present in the falx cerebelli. Diaphragma cerebelli. It is a circular dural fold. It forms the roof of the pituitary fossa. So here is the pituitary fossa and the roof is formed by the diaphragma cerebelli. And this diaphragma cerebelli is pierced by the infundibulum of the pituitary gland. It encloses the anterior and the posterior intercavernous sinuses in the attached margin. Here is the anterior and the posterior intercavernous sinuses. Okay. Coming to the intracranial dural venous sinuses. The venous drainage of the brain does not follow the arteries of the brain. Instead, they drain to the dural sinuses, which subsequently drain into the internal jugular vein. Dural venous sinuses are a group of sinuses or blood channels which drain the venous blood circulating from the cranial cavity. It collectively returns deoxygenated blood from the head to the heart to maintain the systemic circulation. Formation of the dural venous sinuses. They are formed by the following ways. They are formed by the separation of the two layers of the cranial dura or by a reduplication of the meningeal layer. So the dural venous sinuses are formed by the separation of the two layers of the cranial dura or by a reduplication of the meningeal layer. All the venous sinuses lies between the meningeal and the endosteal layers of the dura except the inferior sagittal sinus and the straight sinus. Characteristic features of the dural venous sinuses. Dural venous sinuses lie between the layers of the dura. They are thin-walled. They have no muscle in their walls. They are lined by the endothelium only. Dural venous sinuses are devoid of walls. They drain the blood from the brain and the skull bones. Blood from the dural venous sinus ultimately drain into the internal jugular veins. Dural venous sinuses receive the emissary veins which regulate the blood flow and maintain the equilibrium of venous pressure within and outside the skull. So, the characteristic features of the dural venous sinuses are they are thin-walled, they are lined by the endothelium only, they lie between the layers of the dura, they have no walls, they drain the blood from the they drain the blood from the brain and the skull bones. Blood from the dural venous sinuses drain into the internal jugular veins. Coming to the classification of the dural venous sinuses. Dural venous sinuses are classified into unpaired sinuses and the paired sinuses. Unpaired sinuses are superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior and the posterior cavernous sinuses, and the basilar venous plexus. So these are the unpaired venous sinuses. Paired venous sinuses are transverse venous sinuses, sigmoid sinuses, cavernous sinuses, superior petrosal sinuses, inferior petrosal sinuses, sphenoparietal sinuses, petrosquamous sinuses, and the middle meningeal sinuses. So there are 7 unpaired sinuses and 8 paired sinuses. So paired sinuses in this diagram you can nicely appreciate. Here is the cavernous sinus, then the petrosal sinus, superior petrosal sinus, and the inferior petrosal sinus. Here is the transverse sinus. Here is the sigmoid sinus and the spinoparietal sinus. Here is the spinoparietal sinus. Unpaired sinuses are superior sagittal sinus, inferior sagittal sinus, and the straight sinus. So while dissection, you are going to see the dural fold in this way. This is a falx cerebri, then here is the tentorium cerebelli. So here in the falx cerebri, you are going to see two sinuses, superior sagittal sinus and the inferior sagittal sinus. And at the attached margin, you are going to see the straight sinus, and below that there is the occipital sinus. Medial meningeal vein are often termed as a medial meningeal sinuses. The sigmoid and the transverse sinuses together termed as a lateral sinuses because they are present laterally. Here is the sigmoid sinus and the transverse sinus. Okay. They are together known as the lateral sinus. Sigmoid sinus and the transverse sinuses together termed as a lateral sinuses. Coming to the cavernous sinus. Cavernous sinus is situated in the medial cranial fossa alongside the body of the sphenoid and the sella turcica. So here is the site of the cavernous sinus. It extends from the medial end of the superior orbital fissure to the apex of the petrous temporal bone. Here is the medial end of the superior orbital fissure, and here is the apex of the petrous temporal bone. So it is extend between these two. It is 2 centimeter long and 1 centimeter wide. The name of the cavernous sinus is derived from the spongy appearance of the interior of the sinus. It has roof, floor, lateral, and the medial wall. Roof, lateral border or the lateral wall, floor, medial border or the medial wall. The meningeal layer of the dura forms the roof and the lateral wall. So this meningeal layer will form the lateral wall and the roof, and the interstitial layer will form the medial wall and the floor of the cavernous sinus, and in between here is a cavernous sinus. Relations of the cavernous sinus. Superiorly, there is optic chiasma and the optic tract, internal carotid artery, and the anterior perforated substance. Inferiorly, there is foramen lacerum, junction of body and the greater wing of the sphenoid. Medially, there is pituitary gland and the sphenoidal air sinuses. So, medially, there is pituitary gland and the sphenoidal air sinuses. Laterally, there is temporal lobe and the camon trigeminal. Anteriorly, there is superior orbital fissure and the apex of the orbit. Posteriorly, crus cerebri of the midbrain and the apex of the petrous bone. Structures present in the lateral wall of the cavernous sinus from above downward are oculomotor nerve, trochlear nerve, ophthalmic nerve, and the maxillary nerve. So these 4 nerves are present in the lateral wall of the cavernous sinus. Structure passing through the cavernous sinus are internal carotid artery and the abducent nerve. So the 2 structure passes through the cavernous sinus are internal carotid artery and the abducent nerve. And the structure present in the lateral wall are oculomotor nerve, trochlear nerve, ophthalmic nerve, and the maxillary nerve. Tributaries of the cavernous sinus are superior ophthalmic vein, inferior ophthalmic vein, central vein of retina, medial meningeal vein, spinoparietal sinus, and the superficial medial cerebral veins. So these are the tributaries of the cavernous sinus. Superior ophthalmic vein, inferior ophthalmic vein, central vein of retina, medial meningeal vein, spinoparietal sinus, superficial medial cerebral vein. Draining channels of the cavernous sinus are superior petrosal sinus drains the cavernous sinus into the junction of the transverse and the sigmoid sinuses. The inferior petrosal sinus empties into the internal jugular vein. Communications of the cavernous sinus. Cavernous sinus communicates with the pterygoid venous plexus by emissary veins passing through either foramen ovale or the foramen ovalis. Superior ophthalmic vein connects it with the facial vein. Right and the left cavernous sinuses are interconnected by the intercavernous sinuses. So there are three communication of the cavernous sinus. First one is with the pterygoid venous plexus by the emissary vein, and these emissary veins passes through the foramen ovale or the foramen vasalis. Okay. Then superior ophthalmic vein is connected with the facial vein. Then right and the left cavernous sinuses are interconnected with the intercavernous sinuses. So in this diagram, you can nicely appreciate tributaries of the cavernous sinus, draining channels, and the communications. Okay, tributaries from the orbit, superior and the inferior ophthalmic vein, central vein of retina here. From the meninges, sphenoparietal sinus and the middle meningeal vein. From the brain, superficial middle cerebral vein and the inferior cerebral vein. Draining channels are superior petrosal sinus, inferior petrosal sinus into the sigmoid sinus. Then communication, pterygoid venous plexus, facial vein through the emissary vein passing through the foramen ovale or the spinal. Coming to the clinical anatomy of the cavernous sinus. Each cavernous sinus has a close anatomical relationship with the several key structures in the head and is most clinically important venous sinus. Cavernous sinus thrombosis. Cavernous sinus thrombosis refers to the formation of a clot within the cavernous sinus. Most common cause of the cavernous sinus thrombosis is infection, which typically spreads from the extracranial locations such as orbit, paranasal sinuses, or danger area of the face. Infection is able to spread in this manner due to the anastomosis between the facial vein and the superior ophthalmic vein. We know that there is a communication between the cavernous sinus and the facial vein and the superior ophthalmic vein and the cavernous sinus. Common clinical features include headache, unilateral periorbital edema, eye bulging, photophobia, and cranial nerve palsies. The abducent nerve is the most commonly affected. Treatment is typically with the antibiotic therapy. Thrombosis of the cavernous sinus can rapidly progress to meningitis. Arteriovenous communication. If there is rupture of the internal carotid artery in the fracture of skull, then the arteriovenous communication is established between the internal carotid artery and the cavernous sinus. So the arterial blood rushes into the cavernous sinus, enlarging it. Forcing the blood into the connecting veins, it gives rise to the following signs and the symptoms. Pulsating exophthalmos, ophthalmoplegia, involvement of the third, fourth, and the sixth cranial nerve. So, sometimes when there is a fracture of the skull, that time there is arteriovenous communication occurs between the internal carotid artery and the cavernous sinus. And that time the arterial blood rushes into the cavernous sinus, enlarging it and forcing the blood into the connecting veins. So it will produce the pulsating exophthalmos. Pulsating exophthalmos is a clinical symptom characterized by the protrusion and pulsation of the eyeball with each heartbeat. Coming to the superior sagittal sinus, which is present along the attached margin of the falx cerebri. It extends from the crista galli in front to internal occipital protuberance behind. Usually it ends by continuing as a right transverse sinus. At the termination of the superior sagittal sinus, there is a dilatation known as the confluences of sinuses, where As many as 5 sinuses communicate: superior sagittal sinus, straight sinus, right and the left transverse sinus, and the occipital sinus. So the confluence of sinuses means there is a termination. At the termination of the superior sagittal sinus, there is a dilatation, and that dilatation is known as the confluence of sinuses, where the 5 sinuses communicate. And these sinuses are superior sagittal sinus, straight sinus, right and the left transverse sinus, and the occipital sinus. So here is the superior sagittal sinus, and here you can see the confluences of sinuses. Okay, straight sinus, superior sagittal sinus, transverse sinus, occipital sinus. On reaching the internal occipital protuberance, superior sagittal sinus usually deviates to the right and continues with the right transverse sinus, which in turn become continuous with the right sigmoid sinus. Tributaries of the superior sagittal sinus are superior cerebral veins, parietal emissary veins, small veins from the nasal cavity, and the veins of the frontal air sinuses. So, tributaries are superior cerebral veins, parietal emissary veins, small veins from the nasal cavity, and veins of frontal air sinuses. Clinical importance of the superior sagittal sinus: thrombosis of the superior sagittal sinus, where there is a spread of infection from the dangerous area of the face, skull, and the diploic veins to the superior sagittal sinus, and this leads to thrombosis of the superior sagittal sinus. So this is all about the dural folds and the various sinuses and the cavernous sinus in detail. So you may get question on the dural folds. Dural venous sinuses enumerate the paired or the unpaired sinuses. Then you always get the full question on the cavernous sinus. Short note on the superior sagittal sinus. Dural folds, various dural folds, tentorium cerebelli, then falx cerebelli, diaphragma celli. All these are important questions. Thank you.